Hello and welcome, everyone. Thank you for joining us today. Oh, I see some familiar faces. Hi, Alexandra. Hi, Jimmy. We're just going to take a moment to let folks join. And as you're joining, we're going to drop in some agreements. You might have seen them in the waiting room, but we will drop them in again. I'll go through them now just before we get started, and then I'll kick us off. But for today's discussion, you probably got Zoom notifying you this, but we will be recording this webinar. We don't allow AI note-taking tools for webinars, but if you do need other accommodations, please feel free to message Kabir, who's one of our team members in the chat. And for a discussion like today's and for all discussions, we want to encourage everyone to just be mindful of your presence here and your speech. And by entering the space, we want to agree to be present, authentic. We want the space to be a space that's open-minded and vulnerable. And we also want to acknowledge that when we have difficult discussions, that we do need to increase our tolerance for complexity so that we can maintain this container. And particularly in today's conversation, we might be engaging in difficult conversations around race. And so for protection of everyone here in this space, in this discussion, if anyone engages in racist or bigoted behavior, we will remove you from the space in any future convenience. So with all of that aside, I'll now jump into introductions and welcoming. Hi, everyone. My name is Sherelle Noble. I'm the head of growth and partnership at Beckley Academy. We're so glad that you could join us today for the final webinar in our three-part webinar series, Approaches to Psychedelic Assisted Therapy. We have an awesome team, and you'll see many of these faces here today at Beckley Academy. Our conversation will be hosted by Deborah Gardner, who will give an introduction to herself in a little bit. We have Kabir, who's our manager of learner experiences. He's in the room and also available to you in the chat. If you have questions, you can feel free to direct message him. And then we have two of our awesome faculty members here today, Danielle and Karina, who will also give introductions in a minute. And as we go through today's conversation, I'll serve as kind of host and also question moderator. So when we are in the Q&A section of our discussion, please direct message me your questions and I will moderate the questions and propose them to our panelists. So for today's session, we will start with some introductions and mindfulness. We'll have a 40-minute panel discussion, time for Q&A. And then we'll share some information about our offerings at the end. And we're scheduled for 75 minutes. If you need to drop at any time, please feel free to do so, and you will receive a recording of this session that you can review again later. So with that, I'll hand it over to Deb, and she will kick off our introduction.
I think we will have a little bit of mindfulness with Danielle
That's right.
just to set us up, and then we'll go into that. Thanks, Danielle. Thanks, Sherelle.
Yeah, of course. Hi, everyone. Thank you for being here today. I'm just going to start us off with a little bit of mindfulness, just so we can settle into our bodies a little bit and enter the space together. It'll just be a few minutes. So feel free to do whatever you need to do to feel most comfortable if that means turning off your screen. Either way, offering yourself the deepest breath that you've taken all day. And usually that's an inhale through the nose and an exhale through the mouth. Perhaps you follow that breath up with the deepest breath that you've taken all week, maybe since last week because it's a Monday. And then just letting your breath be natural as you locate your awareness about half an inch below your nostrils. You don't have to do anything to this space. You're just observing that particular area where your breath is. No need to change the breath. Just allowing the breath to be on its natural rhythm. Simply observing. And as you observe, you will notice the same thing that the quantum physicists notice, that the simple act of observation changes that which is observed. The simple act of observation changes that which is observed, the theme we're going to be playing with today. Just observing. And perhaps if you're feeling ready to deepen, you may move all of your awareness to about 4 finger widths distance below your collarbone. There's a space behind the sternum in the center of the chest. Try to locate there. Same thing, just observing, not moving, doing anything in particular. Locate first. And you may feel your heart respond to your awareness being placed in this center. And as an offering, you breathe into your heart. What else is there to do but breathe into your heart? Breathe into your heart as if you're blowing on a glowing ember. Glowing brighter, glowing warmer. And as you notice this glow, simply observe. The simple act of observation changes that which is observed. And maybe when you're here, you offer yourself at least one more deep breath into the heart space this time. A big blow to that ember, the ember glowing brighter, warmer, brightest and warmest. And you may notice a felt shift after your observation. You may not want to come back. There may be some reluctance to open your eyes. And I just want you to notice that being drawn to the beauty of the inner world. But as you perhaps offer yourself at least one more breath to that ember, you simply notice that being drawn and see if you can keep some of that draw with you as we move on to the rest of the webinar today. Taking your time. And we'll start to do some introductions. Thank you for doing that, folks. Thank you for joining us.
Thank you, Danielle.
Yeah.
And thanks everybody for being here. I'll give an introduction to myself and then we'll go into our webinar. So for those of you who don't know me, I am the head of education here at Beckley Academy. I am a longtime educator. I started my career teaching English to students with language-based learning differences. And then for a decade, I was at Sensory Motor Psychotherapy Institute. If you're not familiar, that's Pat Ogden's somatic psychotherapy for trauma and developmental injury. And I was there for a decade as the director of education and found my way to psychedelics because I'm particularly interested in opening up more opportunities and ways to work with traumas that are ongoing, like race-based traumas, and also traumas that are passed through generations, so transgenerational and historical traumas. And today's webinar, a decolonizing approach to psychedelic assisted therapy, we're going to be talking about several things. So the medicalization of psychedelic medicines and the assimilation of psychedelic practices into mental health carries with it a history, stigmas, systemic influences of Western mental health and medical models. And so the discussion we'll be having today with our two faculty, Danielle and Karina, we're going to cover historical and current harms of those models, the appropriation of indigenous practices and wisdom, the limitations of research. And then we're going to dive into skills and practices that practitioners can work to develop, navigating systemic privilege and oppression in the therapeutic relationship, embodying anti-racism, and taking cultural responsibility. And so I will hand it over to first Karina and then Danielle to give introductions before we dive into the prompts.
Hello, everyone. It is a pleasure to be with you here today, feeling very human as we attempt to delve into this fairly complex material. And so just wanted to acknowledge all of our humanity today and mine as I'm saying hello. I'm coming to you today from Southern California and introducing myself first as a mother and a daughter, as a friend and a lover and a student of the divine. And one of the things that has been on my mind recently is the ways in which spiritual practices and approaches in connection to the divine can be so nourishing for all of us. And so how we can start to normalize and incorporate that relationship into the work that we do therapeutically, and especially when we add psychedelic medicines into our work. Professionally, I am the director of psychedelic therapy training at Pacific Neuroscience Institute, as well as the director of diversity, equity, and inclusion. And so I do a lot of training of folks who are just learning how to incorporate psychedelic medicine into therapeutic work. And also facilitating a lot of medicine experiences for people who have not ever received psychedelic medicine before. So thank you, Deb. I'll pass it along to Danielle.
Thanks, Karina. Hi, everyone. My name is Danielle. You just heard me. I am first and foremost a sister, a daughter, a lover, a friend, and an auntie. I'm a queer woman, and a mixed indigenous woman. My mother is Chiricahua Apache, my father and Filipino, and my father is Paskayaki, and that informs a lot of the work that I do. So does my spiritual practice in Inayati Sufism. And I love people for a living. That shows up a lot in my work in psychotherapy, which I mostly work from a decolonial and anti-capitalist lens, and also teaching, facilitating care at Beckley. So we'll be having some harder conversations today about these approaches, and super grateful for y'all for being here. And I'll pass it off to whoever else needs to do intros.
Thank you. Thanks, both of you. I'm so glad to be having this conversation with both of you today. So I'd like to start our discussion with a wide field of vision, really looking at the external systems and their influence on psychedelic assisted therapy. And then we're going to narrow into what practitioners can do themselves. So the first prompt is really about these different systems that we're exploring today. So we're looking at different systems of privilege and oppression, the Western medical model, the Western mental health model, and colonization. And so the first question is, what historical and current harms does the Western medical model, the Western mental health model carry with it that influences psychedelic assisted therapy? And whichever of you would like to respond first, it's totally okay.
Sure, I could get started on that one. Instantly, I sort of think of the term that we've probably all heard a million times, but we refer to the grandfathers of psychotherapy. I just want you to think about those grandfathers for a moment and how the influence to psychedelic assisted therapy is present. The grandfathers typically are white, cis, hetero, monogamous, wealthy men, and their idea of the human psyche is different than many of the clients who we see today, especially those who are working with material and psychedelic assisted work. So just kind of playing with that first, because the field of psychotherapy in and itself is very medicalized and very Western and very colonial in practice. So when we build psychedelic therapy on top of that, we still have those same influences. So much to say there. Yeah.
Yeah, it's a really good point that you're making there, Danielle, in that even if we look at psychedelic assisted therapy from a purely reductionist scientific model, we can think about psychedelics as non-specific amplifiers. And so when we're, introducing a non-specific amplifier indiscriminately into a culture that already contains a lot of harm, we are potentially making things much worse. And so I think one of the things that I like to highlight in these kinds of discussions, when we're talking about historical and current harms of the Western medical model, are first the pathologization of non-Western practices. So how are we pathologizing anything that doesn't feel, like a Western practice? And so we know that psychedelic medicines traditionally, can come from indigenous knowledge. And so these traditional healing practice and spiritual beliefs that occur outside of a Western paradigm have many times been dismissed. And they're dismissed often, not just like ignored, but they're dismissed as primitive or unscientific. And so I think something that we really need to recognize is that if we're including psychedelic medicine into our practices, undermining the value of spiritual beliefs is essentially contributing to the erasure of indigenous knowledge systems. And we're doing something very dangerous there, because we're actually entering into spiritual dimensions when we incorporate psychedelic medicine into our work. And so pathologizing these spiritual dimensions is not only dangerous, it's terribly unethical. It's something that I like to lead with.
Mm-hmm. Mm-hmm.
Yeah, you're both bringing up really good points, and it goes into the next thing I'd like to talk about, which is the impact of colonization. And I think what you really highlighted is this tension, right, between the pathologizing and the devaluing, right, of indigenous practices, indigenous wisdom, while simultaneously, appropriating those, right, for use in this Western model. And so if we could think a little bit about colonization, which involves appropriation, involves exploitation of BIPOC resources, practices, and wisdom, if you could each speak to how colonialism influences psychedelic assisted therapy and what oppressions and what privileges are carried over into the psychedelic field from that lens.
Mm-hmm. Mm-hmm. There's this really great image that I imagine you all may be able to pull up if you look up Dr. Rupa Myra's. This was originally in her Pioneers proposal, I think in 2017 or something, but the image shows that colonization births capitalism and then births white supremacy. And then beneath that are all these other forms of supremacy. And then it kind of moves into the shaping where there's like a trauma point. And the trauma point is sort of how you would move as if you're at the mall and you're trying to locate where are we. If we're psychedelic practitioners, where am I? And if you look at that trauma point, that's where the psychedelic assisted practitioner is. They're held responsible to be healers of trauma points. And so therefore, if you're looking at that trauma point, then your responsibility is to understand the influences of that inflammation. And the inflammation is directly from the birthplace of colonialism, capitalism, white supremacy. So the way that I see it happening is it's internalized in the bodies of individual clients. The identification almost with these systems and the inability oftentimes to understand that the inflammation that is actively happening in their physical bodies or like mental bodies or spiritual bodies is not their fault or is not necessarily their failure to adjust, but rather is an appropriate response to a system that is not broken, but is 100% calculated and oppressive.
Yeah, you're speaking here, Danielle, to something that we see over and over again in our therapeutic practices, and that is the harm that comes from considering ourselves purely individual in the world, right? And so this kind of Western individualistic approach to healing, I think, is expired. We see how this very Western model has failed us. And so, something that Danielle and I have in common is our relational therapeutic approach to work in general, but especially incorporating psychedelic medicine, recognizing the importance of a relational approach to not just therapy, but a relational approach to the world. And so what that means, especially in our work with medicine, is giving before we're receiving, right? So what offering are we making to one another? What offering are we making to the medicine? What offering are we making to the earth prior to extracting or asking for others, people, places, and things to help us? And so it's something that, it affects me personally every day. It affects the folks that I see, but I see it in the collective, how this individualistic approach has failed us and how coming back around to relationships is really the way to heal.
Mm-hmm. Yeah, you're both touching on such important points. And one of the things we're going to dive a little bit deeper into is that, embodied anti-racism, which I think you touched on, Danielle, is like, how do we internalize these systems, right? How do they show up and how can you work with them? And Karina, you're really highlighting the benefit or like a way of working with the community, right? A way of working with things like generosity, and reframing really the way we operate in these systems as almost like survival techniques, right? That you can then turn into more creative resources. So I'd like to talk a little bit about academic research, which we know is a part of this. So the journey of psychedelics, sorry, there's a pop-up here. The journey of psychedelics from indigenous and spiritual practice into a Western medical or mental health model involves academic research. It's the cornerstone of evidence-based research. While research has its benefits that I think we all know of, I'd like to explore the limitations of academic research and those influences on psychedelic assisted therapy. So if you two could each speak to those influences, right, of the Western academic research model on psychedelics, the systemic privilege and oppression that's carried over from that model, and what's the impact on research outcomes?
I think I'll lead in this discussion as a clinical researcher. I participate in a tremendous amount of research in psychedelic assisted therapy and help develop protocols in psychedelic assisted therapy. And so this is a very heavy and complex topic that we're just kind of going to scratch the surface about. I'll start by saying is that research funding is often allocated to institutions and researchers within this Western academic sphere, right, especially in the US. So this essentially perpetuates a cycle of privilege where only certain types of researchers and research and perspectives are prioritized. So we have to recognize that when we're considering the literature, because most of the time it leaves out indigenous and non-Western researchers or approaches that have a long history of working with psychedelics in traditional contexts. And so what does that do? It essentially limits access to research participation. So the criteria for participation in psychedelic studies very often reflect Western norms and health standards. And they often exclude diverse populations. And I want to say that this happens, kind of overtly, but it also happens covertly. Oftentimes it's very difficult to recruit participants in psychedelic research who are historically underrepresented. One, because they're not familiar with research and so they don't trust the process. Two, because there's a tremendous amount of stigma around psychedelics. And three, we don't have environments that are conducive to inviting historically underrepresented populations. And so there's just like this kind of cycle that can occur if we're not open and willing to recognize our part, first of all, but also the ways in which partnering with historically underrepresented communities can shift this. And it can shift it gradually, but we need to start to make these shifts overtly. So what that looks like in our own clinics and organizations is often stating it, so acknowledging that it's a thing, recognizing how we're complicit in it, myself included, and then actively partnering with the community.
That's great. Yeah. Yeah. Thoughts here is just, how historically underrepresented bodies carry, or marginalized bodies carry the almost like intergenerational trauma of harms from research. And I was thinking of a mentor of mine who's now the executive director of Harm Reduction Therapy Center, Maurice Bird, who always refers to, who's challenged the concept of evidence-based practice due to in being in service to so many folks of experiencing homelessness, a lot of Black and Brown folks who want nothing to do with evidence-based practices due to history of harm. And so he flips the model and talks about practice-based evidence. And then additionally, when I hear the words peer review now, I think, well, haven't my ancestors already completed the peer review? So just kind of like questioning constantly these like ways to return to indigenous epistemologies, like reciprocity, as Karina was saying, the return to the relational work and the return to animism, which the success of capitalism and colonialism must function on the actual threat to animism. So we're having to come up with new ways or new ancient ways of doing the work, not brand new ways of doing work. Also getting a pop-up here.
Yeah, and before we move on, in the brand new ways of doing this work, I think practically something that we can consider as researchers is incorporating a kind of a broader range of research methodologies. So even though it's much more difficult and much more complex, including qualitative and mixed methods approaches kind of to capture the complexity of the psychedelic experience and in the complexity of cultural context. So that in and of itself can go a long way.
Yeah, I'm glad you mentioned that, Karina. I think, I mean, you're right in saying it's more difficult to undertake those kinds of research things, but they do capture the complexity, right, that we're really lacking right now in a lot of research studies. I want to zoom in now to the therapeutic relationship. We've talked about context and some systemic influences on the psychedelic assisted therapy, but what steps can therapists or practitioners take to navigate these systems of privilege and oppression as they show up in the therapy room?
Yeah. Just off the top of my head, since at this point, one of the ways I'm almost advertising my clinical work is in a decolonizing approach. When I do my like consults with clients, I'll tell them, we're going to identify those points where you're pointing that arrow back at your own heart and saying that it's me, I'm the problem, I'm the one that's failing to adjust. It's something wrong with me, and slowly but surely turning that arrow back at those major systems that are being embodied. And oftentimes that looks like kind of expressing or showing to clients like, really, you're a good student to this overarching experience of oppression. It's highly relational, which is the way that Beckley kind of runs. It's kind of like you're working with the power dynamics in the room and meeting the client where they're at and being extremely client-centered and being like deeply capable of accessing points of the heart, really highly spiritual, tender, warm, tending to all the relational moments and shifts and ruptures and repairs and honoring the depth of the human experience from the full range of ecstasy to agony. And I would say, just to capture it in a nutshell, that's sort of how I would say it feels, at least. Yeah.
Oh, so beautifully put, Danielle. I think just to add to that, it's recognizing that this really is an inside job first. So, recognizing the ways that the current Western psychological model helps us, but also harms us, and then, considering ways that we want to begin to challenge that framework in our own lives, so that we can appropriately support a participant or a client when they show up in our rooms, recognizing and understanding on a deeply personal level that this is hard work. And we can reflect that back for them. This is hard for me too. And then being willing to consult and have community, so that we don't feel alone, so that we are in healthy relationship with ourselves and our clients and with others.
Yeah, and I'm really glad you touched on consulting with others, because that's such a big part of this, right? It's like you can't do that internal work by yourself in a silo. You need to have other people to talk with, to reflect upon the things that are happening or the things that you're feeling too. So glad you brought that up. You two have kind of touched on this already, but let's dive a little deeper. So, and in our courses at Beckley Academy, we really place significance on the wisdom of the body. As I mentioned, my background is in somatic psychotherapy, and so I care a lot about embodied practice, not only for the therapist, but for the client. And what role does the body play in perpetuating or interrupting harmful implicit biases, racism, oppression? How can therapists enlist the body as an ally in anti-racism and anti-oppression practice?
It's almost a funny question, because I'm like, there's like something about the body's everything, and it still to this day will surprise me when I realize that some therapy is happening that's purely cognitive. Again, such a colonial, such an individualist model in which the body is separate from the mind, but the mind is in the body, and it almost feels elementary to remember that. But in the depth of relational trauma work that I've been doing, the way that we teach at Beckley, we've been finding and noticing that the more somatic we can move the therapy, the more it gets released in ways that isn't even a part of like a verbal consciousness. And I've seen releases occur through somatic work that happen in a few minutes, that can't happen in 10 just cognitive sessions. So yeah, I mean, I'm of the mind, and that the body is carrying almost like these pockets of bubbles of unprocessed trauma, and it's begging for us to be aware of how to release those, and learning how to release those in relationship with others.
Yeah, so after acknowledging the kind of how straightforward this is, as Danielle just said, it's impossible to consider therapy at this point without considering the body, and how the body holds on to so much and is such a beautiful ally in all that we do. So I think first normalizing that and recognizing, and maybe even offering some psychoeducation around that for our participants, and then modeling and teaching somatic awareness, and doing those practices and sessions, helping our participants get comfortable with the idea that their body is a beautiful ally, and many times a signal to what is really hurting us in our culture. And so also kind of supporting other healing practices, like integrating movement and dance or other body-based therapies that can help clients reconnect with their bodies in really empowering ways. So normalizing and showing love and modeling, and so those are all ways to help.
Yeah, and I think about this too, is like so much of it for the practitioner is being able to hold and sit with discomfort in these moments of tension, in these moments of, if there's a rupture that happens. Could you speak to sort of how you prepare and how you hold that space for the uncomfortable stuff?
Yeah, I think part of that for me is certainly acknowledging that I am also a human with a body, and that I am not immune to what's going to show up in the room during a medicine session. And so really taking care, so this is part of the modeling. So taking care of myself well, making sure that I'm well resourced, that I have the hydration and I'm well nourished and that I've stretched and done my prayers in the morning, so that my body is well prepared. And I can offer proper co-regulation for anybody in the room who is experiencing dysregulation or needs help.
Mm-hmm. You know, what Karina is saying is making me think of something that my Shik, my teacher, spiritual teacher, says, which is that you shouldn't necessarily be excited about being initiated into a teaching position, because of the intensity of responsibility that is. And so I'm resonating with Karina on the demands of how much a psychedelic facilitator, therapist, somebody who's holding space really must, if doing the work really ethically and reciprocally, the standards, the ideals are really high. So, you know, we just did a module on preparation and it was 4 hours long. And pretty much for the full 4 hours, Karina mostly was talking about like how to like deeply do your own work so that you're prepared for whatever material could come up during a session or during a dosing session or ceremony or within the entire treatment. So yeah, just tons and tons of your own work to create space.
Yeah, it goes really well into our next question, which is really about what it means, right? What does it mean for therapists, for practitioners in psychedelic assisted therapy to commit to cultural responsibility when they're providing PAT? Why is it necessary? And you know, how can they sort of how can therapists take accountability for their actions, learn from their mistakes, things like that?
Kylia Taylor's Ethics of Caring comes up with the principles of psychedelic assisted work, and one of them are the ethics. One of them is a ongoing commitment to social justice, and I think it's a constant process of remaining a student in the developing awareness of how like sociology and psychology, like how we are culturally in relationship with each other. Yeah, that's a big piece for me.
I think anybody who's joining us here today is well on their way, right? You're interested, you're curious, you want continuous education and training, and you're committed to learning. And so, you know, the other ways that can show up is in self-reflection and in supervision. So asking people and being in community with folks who can help us. And also committing to community engagement and reciprocity, and really asking what that looks like. How can you build relationships with cultural communities, indigenous communities, and the traditional use of psychedelics? So maybe you're supporting initiatives that benefit these communities, or you're seeking guidance or permission when that's appropriate. Really making this a question that you're asking yourself every single day, so that you're ready for the answers when they become available to you.
Yeah, just a quick note here too is just like decolonization doesn't have a definition necessarily, and but a few that I like are a tangible unknown or everyday acts of resurgence. And what I would say just sort of happens, like Karina's saying, is it's every moment you're sort of asking yourself how might this look different. And a big part of that too is just like entering back into the subtle relationships with ancestors. And this could be human ancestors, but this could also be the plants that live near and amongst you, the spirits you're in relationship, who you turn to. Yeah, it does feel that it's almost like this, yeah, really sweet relational approach or return.
I love everything you're bringing up. I'm going to ask a controversial question. Is there a difference in approach here when you're working with a chemically laboratory derived psychedelic versus a plant medicine psychedelic?
Great question. My opinion on this one is there's going to be a difference in the personality of that medicine. Just be in the same way that your friends have different personality, but the egregor, the spirit of each different medicine is still a spirit. It still holds animistic form. So you shape the container differently based off of that personality. If Sherelle comes over, I'm going to offer her a different treat than I'm going to offer another friend that comes over because I know what she likes, right? So it's a similar quality. Yeah.
What a beautiful answer to that question. I couldn't have said it better myself. Working primarily in clinical research with the synthetic forms of these medicines. I've seen them benefit people tremendously. Maria Sabina was asked this question, and she herself said that there was very little difference between the natural medicine and the synthetic medicine. But I love the way that Danielle talked about this, because it highlights the relational aspect of this work, and that is recognizing that each has its own personality and signature, and probably its own benefits for those reasons.
We have a few minutes before we're ready to take questions. Are there any final things you'd like to share with folks? If there could be a few big takeaways for people, or things they could start doing right now, or books they could read, or courses they could take, what would you suggest?
Besides Beckley.
Yeah, our course is a great course. I think I'd like to, there's a lot that we could say here, but I'd like to encourage people to honestly and compassionately make this an inside job. So make this personal work, where we're recognizing how these models, these Western individualistic models have hurt us. And maybe those in the ways that it's disconnected us from our, our own masculinity, our own femininity, our own desires for rest and relaxation, our own need for connection, and then really ask ourselves how that is making a global impact and how that's going to impact the work that we do with the individuals that come to help us and work with us.
I love that. Thank you, Karina. Right. Thought to add here is just a reminder that decolonization is a goal and not an end point. And I think one thing that we can struggle with, because the topic is so heavy, is it can feel hopeless. So my offering is to, yes, adding to the inside job, is to move slowly and with love and with reverence to yourself and to the ecosystem that you live in, that may not be, I mean, really isn't working for us ultimately. But yeah, just this with gentleness, child, is sort of the kind of internal mechanism of this everyday process.
Yeah, and I think as a white person in this space, I really appreciate the work of Resmaa Menakem. So My Grandmother's Hands is a great book to read. The embodied anti-racism training that he runs, which he separated. He has a track for white people and a track for BIPOC, and then sort of everybody comes together, was really, really awesome, and just a really great way to start to like look at how, as a white person, you hold these systemic oppressions in your body, and they play out right in relationship.
You may also consider Dr. Monica Williams' work with microaggressions and cultural appropriation. And so she has a wonderful book, and she has a lot of resources on her website.
Couple names to add to the mix are Dr. Carl Hart for anything on harm reduction, psychedelic exceptionalism. I haven't read the book yet, but Jennifer Mullen wrote a Decolonizing psychotherapy book that recently came out. There's also there's some material. I would say the Emerald podcast has a really great episode on what is it, that the revolution will not be psychologized, which I feel like is good decolonial training. And then psychedelic liberation training is also an option. There's all kinds of good stuff out there.
Yeah, and then having, oh, sorry, Karina.
You're just going to second that Emerald podcast.
Yes.
It's like maybe 90 minutes, but it's got a lot of rich information especially about animism, specifically Afro-Brazilian animism, and the way that we can bring in those spiritist and spiritual approaches to our work.
Yeah, yeah. All great recommendations. Then also having these conversations, right? Being used to talking about these things, touching on some of these more difficult topics, getting used to that, holding space for that discomfort is something else that we can do too. Mm-hmm. Thank you both so much for being here, for sharing your wisdom with us. And I think we are ready to take some questions.
Great. So yes, as a reminder, feel free to send me your questions directly in the chat. We've had one question so far. So this question comes and says, I had a scenario where the journeyer never felt safe in their mind and body for a number of valid reasons. And so they didn't view their body or mind as allies, but rather as enemies. This created huge blockages in the somatic process. So our questioner asked, is there any wisdom that can be drawn from a decolonization aspect?
Yeah, great. Hi, Jimmy. It's good to see you. Yeah, so I'm glad, I really appreciate this question, because I would say, so I do a decolonizing psychedelic therapy training at different universities, and a common question that I'll get is, what do I do with the teenager who, when you teach them about systemic oppressions and teach them about colonialism, capitalism, white supremacy, you help them sort of identify that the anger that they then respond with is so big that it almost can feel like a block to the work, right? Then they're just angry. And so this feels similar, where there's this like the enemies, the huge blockages in the somatic process. So work with it, work with the anger, the boundary that's coming up towards the enemy, because there's something. Why does the enemy exist to begin with? Is due to an acknowledgement or an awareness that a boundary is being violated. The boundary exists because the individual ultimately knows that it doesn't feel right. So there's a somatic point there where you're like, this is supposed to be different. And I'll always say, find where the disappointment is. Disappointment is really great to work with, because within it, we get to identify that we wanted to be treated or wanted to experience something different or in a better way than we actually did. And that is our almost like organic way of worthiness and self-love. So there is something there where you can stretch it for its experience and go into the feeling of that like almost war that's kind of happening with the enemy. I wonder if, so curious what you think about this. Wish you could have a whole conversation on it. Yeah, hope that helps.
Beautiful.
Yeah, I think another, oh, sorry, Karina.
Yep, just beautiful.
From a trauma lens, sometimes it's not safe for people to go into their body, right? Sometimes it's dysregulating. Sometimes it re-traumatizes. And so I think what we often hear with psychedelics is like, the medicine will show you what you need, and it might, you might not be ready to do that. And so I think that there's some wisdom in that too, where, you can work on little bits of resourcing, little bits of getting connected to the body that's less overwhelming over time, but it might be a different model than sort of diving all in, which sometimes psychedelics does. Mm-hmm. There might also be something interesting to say about using ketamine in that situation, which is a dissociative. So,
right. Yeah.
Great.
Any other questions?
I haven't received any other questions yet. So if you have a question, please DM it to me. I'm wondering if in the meantime, if we have any other topics for discussion.
I have a question about referrals. It's something we talk about sometimes in our courses. It's like, let's say you're providing service for or therapy for a client, and it's not the right fit, and you can just tell it's not the right fit. How do you navigate that? How do you know when it's not the right fit? And, how can you sort of normalize, right? Like referring someone else to someone else's care.
I think this is a great way to model honesty and authenticity. And it's very similar to how we would in traditional talk therapy or referral in, any other profession. And that is recognizing our specialties, but also our limitations. And I think one way that we can really honestly acknowledge that is by asking after intake or assessment, really taking some time to listen to how we're feeling, how our body is responding to the experience that we just had, how our mind is responding, and then asking ourselves if we truly feel like we can be of assistance to this person. And where the answers are no, we may want to sit with that for a while. And if it still feels like we're not the appropriate person to work with, which is perfectly natural and normal, we're humans and doesn't mean that we're going to do well in all relationships, that we have a good network of folks that we can refer out to. And so this speaks to the importance of community in this work, recognizing that this is still a very nascent field. And so being in good communication and relationship with folks in our communities who are doing this work.
Any other questions come in, Cheryl?
Yes, we had a question. What are your thoughts on having clients journal and document their experience after a journey, which sounds like kind of broader integration type work?
Highly recommended. Yeah, definitely. It's a big part of integration. Typically after at least a psychedelic session, I will hand over handwritten notes that I did for a client. And then there's a plan almost for their continued integration. And oftentimes journaling is one of those. If that's a medium in which that self-reflective process is really helpful for them. Sometimes it's singing, sometimes it's playing an instrument, sometimes it's doing a different sort of art form, dancing. But if writing in that form, self-reflective form is helpful, it could be really powerful to see what continues to emerge.
Yeah, I would highly recommend writing after a session. During a session, it's very difficult to write oftentimes. And so what we often offer a participant is that we will be their scribe throughout the process. And so if they feel like there's something that they really want to remember, something poignant that emerges from their journey, you can just say it out loud and we're there to write it down and offer it to them afterward.
Well, aligned with what we've been talking about today, is there a use in the practitioner, the therapist journaling after a session?
Yeah.
What came up or what emerged? Yeah.
Yeah, I think it's one way of our kind of our own integration, and I think you're bringing up kind of a larger, larger important point, Deb, and that is taking some time after spending 3, 4, 8, sometimes 13 hours, as is the case in an LSD session, with a person, that we're really taking time to debrief, either with our co-therapist or with ourselves or our team, but also recognizing how we're feeling. And what has shown up for us, and then what insights we feel might be helpful for that participant moving forward. There's such rich information that can occur right after a session if we just allow the time for that information to emerge.
Great, thank you. I have a question, and for anyone else who had their hand raised, or if you still have questions, feel free to drop them directly to me. A question that I have for the both of you is, it can seem so big to confront capitalism or white supremacy or colonization. I'm curious if you have any case examples of how a client maybe grappled with something that big, but then made, to Danielle's point, those kind of smaller adjustments and things in our life that had them have more resilience or empowerment.
I can give a short example of a case, where I was in relationship with this person for many months. And so the abbreviated answer here is, because I work a lot with folks who have suffered from religious trauma, it was working and incorporating ketamine in that work. And so, something that was really valuable for that particular participant was first normalizing the trauma that occurred during the course of her life, and then incorporating any and all the spiritual practices or approaches that were available to us within the ketamine session. And so that included including music that was specific to the practice that she wanted to explore, allowing her body to make the movements that were specific to that practice. And many other things. And what that finally allowed her to do is actually come back to her original spiritual tradition, which was Catholicism, in a whole new way, and really receive it and begin to practice it by also incorporating some of the more novel spiritual practices that had shown up and come up in the work that we did together.
Lovely, Karina. I always love hearing little snippets of your work. One that comes up for me is actually, this has happened with a couple of different clients of mine who are white. And again, these topics can be really intense and kind of sometimes even especially for white bodies and having to hold the positionality of like, oh gosh, was I a perpetrator of something or my ancestors were? And a common thing that can happen, especially with ketamine work, I mean, really with medicine work, is a sort of reconnection to the spiritual realm and to the ancestral realm. And for a couple of my white clients who've sort of been hesitant to do that because of an identifying, like being like, they've harmed people, was actually to go even further back and to sort of return to, you know, kind of the underlying piece of whiteness harms all of us, not just people of color, in the same way that toxic masculinity or patriarchy harms men, right? Or and so, you know, for example, it's like kind of returning to like some of the like ancestral medicines and rituals that have also been lost as assimilation into whiteness, or the false notion of white supremacy sort of continues. And that has been really lovely to have people bring in some of their like lost ancestry and even some instruments that they're playing that I would have never known existed, and they're just told that they're American now, right? So it's been really lovely work. Great question, Cheryl.
Thank you both. Thank you both for those examples. I don't have any further questions, and we're just at the top of the hour. So Deb, do you have any final closing words? Otherwise, I can move into the next section.
Just thank you both so much for that conversation. Appreciate it. Appreciate all of you being here. And thanks, Sherelle, for taking this next part talking about our courses.
Great. Okay, so let me just pop up some slides. All right, so in the last 15 minutes of the webinar, I wanted to share a little bit about our two offerings at Beckley Academy, and then we're happy to answer any questions that you may have on our offerings. So we have two different opportunities for people who are interested in learning more about psychedelic assisted therapy and about psychedelic care. Our first offering here is the Essentials of Psychedelic Care course. This one is designed to be a great onboarding for folks who are interested in learning about how psychedelic assisted therapy is going to work across a care team. This is a self-paced course. It's online learning. It's about 33 hours, and it's designed for professionals. This doesn't have any licensing requirements. And so you're invited to come and join this course if you're trying to figure out, okay, how might I potentially support someone if I am a clinic owner, if I'm a nurse, if I want to do some coaching, if I'm working, you know, in a harm reduction or peer support capacity. This is a great course for you. And this is really based on a harm reduction model. And it also is based on collaborative care. And what we mean by collaborative care is like, you know, I might be supporting a client through one part of their journey, but I also want to make sure that I know how I can ethically, you know, refer them out to other people when there's something that maybe I'm not licensed or in a position to hold. And this course is complementary to our other course, which is a longer, more in-depth course focused on the therapy part of psychedelic assisted therapy. And this is our relational psychedelic assisted therapy course. And so this course, Danielle and Karina are both going to be faculty members for our offerings in the fall. And it is a 6-month deep dive into the therapeutic skills that somebody needs to work with people in non-ordinary states of consciousness. It's a 72-hour offering, and it's really designed to allow you to do a lot of that inner work that Deb, Danielle, and Karina spoke about today. And so we teach from that decolonized perspective, and also from the perspective of building your own capacity as a therapist to hold this space. Some of the ways in which we do that is we have it designed to be an intimate cohort of 20 to 30 learners so that you really do have this nice, safe container space where you can have great in-depth discussions and practice a lot of these skills. So it's a combination of live meetings with some asynchronous prep. And this course is designed for licensed mental health professionals who have previous therapy experience so that you can go deeper into those skills. And again, these two courses really complement each other. And so it really depends, as a practitioner or as a person who wants to be involved in this field, where you are on that spectrum of care. Let me see. Great. I wanted to pause there and see if anyone had any questions on the offerings themselves. And Kabir, who's here and available in the chat, he can drop in his Calendly link, and we're more than happy to schedule a phone call with you and also like consult on your specific case and see, what might make sense for where you are on your journey. So let me stop this share and just see if any questions come through. Okay. Yes, thank you, Kabir. Yeah, I'll just say for myself, I'm in grad school right now, also to become a therapist and one day to become a psychedelic therapist, and being able to do the relational psychedelic assisted therapy course while in process of my broader therapeutic learning has been so helpful. It kind of gave me the insight into where, this paradigm shift of mental health that psychedelic assisted therapy is, where those skills are, and then it's let me like backwards fill in as I go through my regular master's degree, understanding where those different therapeutic skills show up and how they relate. Thank you, Katie. All right, well, if we don't have any more questions, I think that, we can stick around for another couple minutes in case anyone wants to ask us something directly, but otherwise we'll go ahead and close today's webinar. And thank you again, Danielle, Karina, Deb, for the fabulous conversations. And thank you to our audience members for being here and helping us hold the space for this conversation.